Good evening, everyone. I am so excited to be here, and I think you're all excited to be here too. It's going to be an amazing evening. Tonight, I'm just going to quickly talk a little bit about Women Focus Canada. Women Focus Canada is an organization based here in Toronto and has really based here in Canada and has gone pretty far and wide. This is an organization that takes, look into supporting women and people in the GTA. But today we're going to be having a meeting where we're talking about anxiety, depression, psychosocial support, and community resources during COVID-19. And all this has been put together and is specifically designed for the Afro-Caribbean community in the GTA, but trust me, every other community is all welcome to be part of this evening's event. So now we're going to be going straight to our first speaker for the night, and he is a doctor, a well-known and respected doctor in the community is Dr. Nnamdi Ugwunze, attending physician in forensic psychiatry and adjunct professor, Schulich School of Medicine and Dentistry.
Thank you for that very generous introduction. I was asked to be a part of this, and I couldn't really refuse. I just hope that today my talk will be able to give people a bit more information as to the common mental disorders that are prevalent in our community and really in the world at large. Today, I would like to talk about anxiety and depression. Particularly that because it is quite common. Very few people recognize the symptoms and the amount of suffering it impacts on people who have been diagnosed with it and their carers and loved ones. I believe that knowledge about anxiety and depression is also quite pertinent, especially in the current climate with the COVID-19 pandemic, which has made a lot of people quite worried and with a lot of disinformation out there. Quickly, I'd just like to talk about what my objectives will be today. Try to give you information as to how to recognize somebody that may well be suffering from anxiety or depression, how to seek help, and obviously common treatment modalities that are available, as well as ongoing support for carers and their families as well. Quickly, I'd just like to quote a wide common saying that people may be familiar with. It is an old ancient Greek saying that whom the gods would destroy, they first make mad. I think this is pertinent because there is a lot of stigma attached to mental illness, and people don't really understand the amount of suffering that patients undergo, as well as their loved ones. Mainly, mental disorders, especially for anxiety and depression, are commonly recognized disorders, which is quite prevalent in the world. I will give you some statistics. The WHO, World Health Organization, estimates that at least there are over 264 million people who suffer from depression across the world. This was the current statistic as of 2017. I'm sure that would have increased by now with what's happening in the world. Today, I would like to start off with anxiety and try to obviously talk about some of the symptoms that we use to diagnose anxiety. From a lay point of view, anxiety can be a heightened sense of worry, nervousness. There are different forms of anxiety. The most common is what we call the term generalized anxiety disorder. The people that suffer with this particular disorder can describe themselves being extremely anxious, nervous, worried. Sometimes they're able to identify triggers that might set this off. Most times they can't, so we describe it as free-floating anxiety, meaning it can come on at any time. It may not be triggered by anything. Some of the physiological changes that do happen when someone becomes anxious are things like increased heart rate. Some people will have this inner feeling of restlessness, very worried that something bad will happen. Some other people will find out that they are unable to concentrate and sit still. Anxiety can also come closely related with panic, which we also call panic disorder. In those circumstances, the sufferer believes that something really bad is going to happen. They feel out of control. They feel that they are quite overwhelmed. They can't help themselves. They describe having things like butterflies in their stomach. They are trying to escape that scenario or that situation in which they find themselves. Some of them start hyperventilating, breathing very fast. What that tends to happen is to reduce the oxygen that is available to the brain, which heightens their sense of panic. Other people describe symptoms as feeling that they are having a heart attack. And some people actually pass out. This is not generalized to everybody, but this is how significant and debilitating this can be. For people that have been diagnosed with clinical anxiety, it is to such a level where it impacts negatively on their social and occupational functioning. Simple tasks that we take for granted, like going shopping, driving a car, can become triggers for them. They become extremely anxious. How do we relate that to what's happening in the world today? Obviously, there is a virus out there which is causing a worldwide pandemic. People have died. Some countries have fared better than others. But there is also a lot of information about this disease that we do not know. So it's almost as if we're clutching at straws. So people are worried that, okay, maybe if they go out of their house, they'll catch the disease. If they don't wash their hands, they'll catch the disease. So a lot of my patients that have been diagnosed with anxiety have actually seen the anxiety symptoms ramp up and they become pretty much trapped in their homes. This has impacted a lot of suffering on their family and loved ones. Those are even the ones that are lucky to have people next to them. Quite a few people are unfortunate that they live alone, and this has even worsened things for them. They can't even go out to do grocery shopping. They rely on neighbors to be able to obviously provide them with sustenance. You can imagine this is not a situation you want to find yourself in. For people who have loved ones or people you know that may be exhibiting some of these symptoms, the good thing is that there is help and there are treatments that have been tried and tested and do work. The first thing I would advise is if you see somebody that has been unable to function and exhibiting some of these symptoms, being there and listening to them would help. You could also encourage them to try and get access to their family doctor or general practitioners. Most general practitioners are quite adept at diagnosing and treating anxiety. Common pharmacological therapies available to treat anxiety are mainly antidepressants. I'd like to dispel a myth. People think that antidepressants are addictive. No, they are not. People also think that once you're on antidepressants, you can't come off them. That is also quite incorrect. People also think that antidepressants might somehow interfere with your cognitive abilities, meaning the way you think, and may, probably cause you some cognitive difficulties when you grow older. That is also inaccurate. On the contrary, antidepressants can actually be quite neuroprotective because any mental disorder, we have been established that mental disorders can be quite toxic and stressful to the brain. And in that vein, having any untreated mental disorder whatsoever, be it psychosis or the affective disorders such as anxiety or depression, can actually be quite harmful to long-term memory and cognitive abilities. The common antidepressants we tend to use obviously will be tailored to the individual. We'll talk about things like the SSRIs, which are called the serotonin selective reuptake inhibitors. We have other classes as the SNRIs. What we tend to do, and then there are the older ones called the tricyclic antidepressants, which we reserve for treatment-resistant anxiety and those that have not really they have not really responded to treatment of SSRIs. Why we chose the SSRIs primarily is because they have a less they have less toxic side effect profiles. They are better for younger people. They are more alerting and less sedating. And more importantly, they are less toxic when they are taken inadvertently or knowingly as an overdose. I would also like to stress that medication is not the only treatment modalities available for treating anxiety. We could also have psychological therapies. Basically what that means, they are called the talking therapies. Specifically for anxiety, we have what is called the anxiety management, which is a model of talking therapy that is delivered to help the patient develop coping skills to be able to confront the anxiety and manage it in a situation that becomes less overwhelming and makes them function better. These psychological therapies can be administered by trained therapists ranging from a clinical psychologist as well as other professionals who have been trained to administer anxiety management. I'll quickly like to jump into depression. Depression has been stated by the World Health Organization as being actually the most debilitating mental disorder and causes the most morbidity in people around the world. Depression can be diagnosed also by your family doctor and also by a psychiatrist. There are telltale signs of depression, which we tend to classify as biological symptoms. Depression is not just when somebody feels sad. Those are normal ranges of emotion. If you're happy, you get good news, you're happy. Something makes you sad, you're sad. But when you have a sustained period of low mood that has lasted for at least 2 weeks, and you have other biological symptoms such as sleep changes, inability to fall asleep, which will be initial insomnia or frequent awakenings, middle insomnia, early morning awakening. If you normally sleep 8 hours in a day and you find yourself not being able to sleep at night and waking up around 5 or 6 in the morning as against your 7 or 8, those are symptoms you should also kind of be thinking about. We also have people who suffer from depression may also not enjoy activities that previously they derived pleasure from. And they also describe being very lethargic and very tired. They are not motivated to do much things. In very severe cases as well, people with severe depression can have negative thoughts, believing that their life as it is isn't worth living, that they're better off dead. And they tend to have suicidal ideation. And unfortunately, some people without the necessary help in a timely manner might believe that they have no other way out and might actually attempt and contemplate, in the unfortunate event, complete suicide. So those are the things we try to prevent. With depression, like I did say, it causes a lot of comorbidity in the community. It stops people from functioning normally. So identifying it and trying to get help is crucial. Treatment modalities for depression are mainly from a pharmacological point of view, medication, antidepressants. I mentioned earlier on, antidepressants are not addictive. They are actually quite neuroprotective, meaning that they help you recover quicker. Also, we have psychological approaches to treating depression. And some of the psychological therapies offered are called CBT, cognitive behavioral therapy. This works on the basis that how we think and how we see the world affects how we feel. So if you think the world is a dangerous place or you're not good enough, you're less likely to try out something. And that just reinforces the fact that you're not good enough. So we try and change that cognitive thinking style to a more positive approach, encouraging people to try things, and as they get good results, they're encouraging them further to do stuff. Other treatment modalities psychologically include interpersonal psychotherapy, and we also have supportive psychotherapy. For instance, in these clients, if you lost your job, say you're falling on hard times, and you feel there is nothing else for you, even having somebody not in a formalized setting to even speak to can be quite helpful. So communities are encouraged to reach out to people, don't suffer in isolation. There is still a lot of stigma attached to mental health, which is unfortunate in the 21st century, but this is something that education would help. So people will feel that they are human and they are able to seek help. I'd like to just quickly talk about certain circumstances where you might be compelled to act if you feel the person's life is in danger. And there are different forms under the Mental Health Act that can be used to compel somebody to attend hospital for an assessment. The first is actually a Form 2, which is an order for examination, which a loved one or a member of the public can approach a justice of the peace to get signed. This gives the police powers to actually come and remove this individual to a hospital where they can be assessed. It does not give the powers to keep them in hospital. A Form 1 is a detention power where it can keep someone in hospital for up to 72 hours following an assessment. And finally, there is a Form 3 as well, which is a certificate of involuntary admission, where you can compel somebody to stay in hospital for up to 13 days to receive treatment for an established mental disorder. And finally, there is also the commonly used one, which is a Form 4, which is a certificate of renewal. You can be renewed subsequently every month. I'd like to stress that you cannot treat anybody who is deemed to be capable of making a decision in regards to treatment for their mental illness. If you feel that they are not capable, they have to be deemed incapable, and a substitute decision maker needs to be appointed. I know this is a very kind of jumbled presentation for anxiety and depression, which I can talk about all day, but I just wanted to let people know that it is quite prevalent, and we are seeing more cases of people suffering from anxiety and depression, especially in these uncertain times. And if there's any take-home message you have today, if you see anybody's change in presentation, they become quieter, they become withdrawn, the first thing is to speak to them, try and find out if there's anything you can do to help. And obviously, if you suspect there is a possibility of a mental illness, advise them and encourage them to attend their family doctor in the first instance.
Thank you so much, Dr. Nnamdi. That was an amazing presentation. We're going straight to the next, the second speaker, and is a woman of repute, Dr. Oluremi Adewale. She's the president and CEO founder, Women Focus Canada, Inc. Dr. Remy, the floor is yours now.
Thank you so much. COVID-19 has impacted everyone worldwide, and the impact is very noticeable amongst the Blacks and people of color. That is the fact. I will be focusing today on mental health promotion, meaning the actions that you can take to improve your mental health. Before I start, I'd like to warn you that because of the sensitivity of the subject matter in this webinar, you might be triggered. I encourage you to think about self-care and practice what you find helpful. I invite you to talk to your healthcare practitioner. Dr. Nnamdi said the same thing, a family member or a friend who you trust. On the other hand, I invite you to be the supportive friend to someone struggling with mental health. So what is mental health? Mental health is the capacity of each one of us to feel, to think, and to act in ways that enhance our ability to enjoy life and to deal with the challenges that we face. A major challenge facing individuals, families, communities, and countries currently is the COVID-19 pandemic. COVID-19 has compounded with the stress of the lockdowns, isolation, worrying about not having enough money, worrying about the death of a loved one, and of course, the safety of children returning to school in September has increased significantly the risk for anxiety, and depression. People pay more attention to their physical health than their mental health. And this could be some of the things that Dr. Nnamdi has mentioned because of the shame and the stigma associated with mental health. The key to achieving maximum well-being is to have a balance of good physical health and mental health. After all, according to the World Health Organization, there is no health without mental health. So mental health is a fundamental right for all of us, and it is determined by changes in many factors, including the socio-economic factors, i.e. poor social support. We also have the biological factors, which is genetic, that we don't have much control over. We can still do something about it. And there are the environmental factors. An example is drug exposure before birth. And of course, I want to mention the psychological factors. An example would be a trauma from abuse as a child. And we know that many children worldwide are being abused as we speak. So I just also want to, if you look at this graph here, you will agree with me that stress is a normal part of life. And stress is different for everyone. We have good stress and we have bad stress. The stress is not necessarily a bad thing. When you have a little stress, you have low motivation, your performance will be low. When you have a moderate stress, you'll be alert, energized, you'll be challenged if you're a student. You want to stay up at night, you want to study. And when you have a high, too much stress, you can have an anxiety. So what stress is different from each individual. Currently, most parents are stressed out because of many unanswered questions regarding to the provincial, or if you live in some countries, state government plans for children starting school or daycare in September. Of course, rightfully so, many daycare staff and teachers are also concerned about their own safety. It is important that you learn how to manage your stress, because ongoing stress that is not managed can kill you slowly, silently, or secretly. An example of an ongoing stress is for those people that live in countries where there is traffic, every day panicking of going to work and thinking about what you have to do. You cannot sleep at night because you're thinking about, oh, maybe there will be traffic in the morning. But there are some things that we can do about our stressful life. You can have a family bonding time. It is actually a very good time for us to have family bonding, but it has to be a one that is meaningful, especially with your children. It's important that you develop healthy and trusting relationships with your children. So this will allow them to come to you for guidance. if you don't give them the opportunity, they will still get it. They'll get it somewhere else. You know why? It can be online. And it can be from friends. And it might not be the right thing you want them to do. So we need to pay attention to warning signs of the onset of potential mental health disorders. Dr. Nnamdi mentioned some of these. You need to know the red flags. Sometimes the red flags are not there. We've seen those situations. And sometimes they are there, but we're not paying attention to them. When a child comes to you and says, Mom or Dad, please, I need to talk to you. Please be there and listen to them. Don't be multitasking at that time because you might be mixing an important opportunity. Some of the red flags we're talking about could be things like out of control behaviors that can be harmful. You need to pay attention to see that. It could be that people talking about harming themselves or harming other people, talking about death or suicide. It could be persistent sadness. Dr. Nnamdi mentioned 2 weeks or more. And what can you do as a parent, as a teacher, as a community leader, or as a friend, as a family? Number one thing that I will say is be present. Pay full attention and validate their feelings. It is their feelings. Ask helpful questions when appropriate. How can I support you? Your approach will be different, of course, based on the age and intellectual capacity of the individual or the child that you are speaking to or speaking with. You can develop or co-develop safety strategies and safety planning. Assess the need to take the child to the hospital. Assess that. Based on what I'm seeing, based on what I'm hearing, is it time for me to call 911 if you are in a country where you can do that? Or is it time for me to drive my child or the person in my home or my friend or advise them to go to the hospital? If you can call 911, what about if you live in the GTA? There are some distress helpline that you can call. And it is 24/7. It is confidential. I can give you the number here now. It's 416-408-4357. It's important that we do something when we see red flags. I'm sorry that I'm a little bit in a rush with this presentation. I have some key things that I want to mention. So I want to show you this mental health continuum. And the reason why I'm showing this one is to know that because someone is diagnosed with mental illness does not mean that this person cannot function in life. Mental health is fluid and constantly changing. And we've seen that with the impact of COVID, that some people have lost their jobs. Some people have lost a loved one. And it's just turned them from one continuum to another continuum. Everyone can fall into any of these categories in the mental health continuum as shown here. An example of optimal mental health is a person with a diagnosis of serious mental health, but this person is still coping well. And this person can be considered somebody that has positive mental well-being. An example of a serious mental illness, according to this continuum, is a person with a diagnosis of serious mental illness and also has poor mental health. And according to this, an example of an optimal mental health is a person with positive mental health with no mental illness. That's what we strive for, but we know we don't always get it, and sometimes we don't stay there all the time. An example of no symptoms of mental illness is a person with no diagnosis of mental illness, but they do have poor mental health. Have you ever seen somebody and say, oh my God, being judgmental, that is happening, that you've seen somebody and you automatically think that the person do have mental illness or diagnosed, but it's just as a result of poor mental health. So people experiencing mental illness can have resources. Take home, please. can have resources to draw from that can promote their recovery and protect them from worsening the illness. It's high time we stop stigmatizing people with mental illnesses. It's high time you know that anyone can fall into that category at any time in their life. So our body, when you look at this one, is an alarm clock. Many of us do have alarm clock at home, but I just want to bring something in here while using this. Our body has ways of telling us that we are stressed, but many times we ignore the warnings. And an important step in dealing with our stressor is to become aware of the changes that happened in our body or that is happening in our body. We can use different parts of our body as alarm clocks to pay attention to changes. For example, we might notice in our body alarm clock, I think Dr. Nnamdi spoke to this one, changes in our sleeping pattern, loss of appetite. You might see that you're having headaches that are coming and going. You need to do something about it. Don't just stop using pain medication, start using pain medication for that. In our minds, what are the alarm clocks? And increase negativity and being more critical of others. When you becoming like that, you see that this is something that is not you. Check yourself. Emotionally, there are some alarms that can happen. Changes in, when you see yourself crying a lot, on and off, getting angry, being irritable. Spiritual alarm clock do exist as well. Changing in prayer practices or changing in spirituality, because we're all human beings. Whatever you used to practice and believe in before, why are you not believing in that thing again? Because of the challenges and issues that you are going through. Pay attention. It's okay. But what you need to do is to seek help. Relationships alarms do happen. You could find that you are withdrawing from wanting to spend time with friends or family members or people that you really used to enjoy spending time with. I want to show you this work-life balance. I'm going to ask you a question and I want you to take this home and think about it. How do you slide your pie of life? Good question I want you to think about, because it's important we do not only say work-life balance, but we're not practicing it. We need to intentionally develop boundaries in our work and personal life and maintain those boundaries. We should be comfortable to say no to tasks that will cause us an ongoing stress. We talked earlier on about chronic stress, the everyday stress that we don't want. I'm going to talk a little bit about resiliency. What is resiliency? We talked about that. Resiliency is the ability to successfully manage high level of challenge and change, and to bounce back after stressful and traumatic events. A lot of people worldwide are going through stressful times. And some of people are coping because of past experiences. What did you do in the past that you find helpful? Who did you talk to in the past that you find helpful? Think about going back to those people. Think about going back to those things that you've done in the past that was helpful to you. Most people are resilient to some extent. And resiliency can be learned and developed. It is a process. It's not just a personality characteristics or skills. And high resiliency has been linked to positive mental health well-being. So I'm just gonna quickly mention a few strategies here that you can consider to maintain you need to maintain a realistic view. Think about discovering meaning and purpose for your life. Sometimes we need to accept the change as part of living. And it's so important to nurture a positive view of yourself. I think I'm being told that my time is limited here. We talked about self-care. If you don't take care of yourself and love yourself, who will? I want you to leave this presentation and say over and over and let it resonate with you. If I don't take care of myself and love myself, who will? Remember when you are in the plane and they said, when you're traveling and they said, put on your mask first. Have your seat at the table and invest in yourself. Establish your priorities. It's important that we do that. To include daily self-care strategies. Focus on what brings joy and happiness to you and extend that joy and happiness to other people. For example, take 10 minutes to listen to your favorite music, 5 minutes to meditate, 5 minutes to appreciate something meaningful to you. Intentionally incorporate gratitude into your day. If you look at, no matter how bad the situation is, you will find reasons to be grateful. Appreciate joyful moments. Discover yourself and your talent, even at this hard time. Take baby steps. Try to practice self-compassion and be comfortable with the decision to do so. Remember that you can better support others, like I said earlier on, when you are well grounded. You are not defined by your current circumstances and situation. You can fall, anybody can fall, but do not keep falling. Ask for help to get up if you're unable to get up by yourself. Most importantly, spend quality time with your children and significant others. Your children are also going through rough times with the COVID-19. Do not leave them alone in front of the television watching TV all day long. And if you are so worried, if your mind will not stop worrying, take a few deep breaths to reduce your stress in the moment. Exercise is helpful in managing stress and energizing you. Talk to a trusted friend and family. Remember, you can do virtual therapy and counseling with your doctor and your counselor if you are worried to go out now because of COVID and see anybody. I thank you so much for listening, and I'm going to ask you to take a few seconds wherever you are to just take a deep breath in. Exhale. Thank you so much.
Thank you, thank you, thank you so much, Dr. Remi. So without wasting too much time, I'm going straight to our third speaker, and that is Mrs. Margaret Nwosu. She's a registered social worker and program manager and coordinator. Mrs. Margaret, the floor is yours now.
Thank you so much. Thank you for this opportunity to be one of the panelists in this webinar. I want to appreciate Dr. Oluremi Adewale for this privilege. I don't take it for granted. Thank you so much. Like you said, my name is Margaret Nwosu. I work with a women organization, Rexel Women Center, as a program manager, supporting newcomers, and also I'm a registered social worker. So Dr. Nnamdi Ugwunze has already talked about the health aspect of this webinar, and also Dr. Oluremi did a great justice, kind of linked to what we do too as social workers, in also explaining and giving us different coping strategies that we all will go home and practice and help, to develop ourselves. So I will be talking, more, one of the scope of practice for social workers is helping the individuals, or like we say, the clients, to achieve for the achievement of their optimum psychosocial functioning. So in the context of this webinar, I'll be talking more about the psychosocial aspects of the mental health, or the support that is available in the community. So the psychosocial is like a fusion, or it's not just like, it's a fusion of psychological and social aspect of one's life. So understanding and learning the behavior, and the social needs of the individual, the families, the community, and the society at large. What are the things that, what are the things that they need? What are the things that, Dr. Remy talked about the mental health, and also Dr. Ugwunze talked about the mental health of the individuals. But what are those environmental factors? What are the things that are around the individual that will be helping them, to cope, especially in this COVID-19 period? Sorry, Rowena is doing the slides. Okay, thank you. So we're going to be talking about the social determinants of health. We're talking about food and housing, job security, environment and safety, culture and language. So what are these things, for the individual? What does it do for the individual? In Dr. Remy's slide, she talked about, the mental health and the mental illness. So what are, some people are not mentally ill, but because of the mental health that comes from, probably not, being able to access or have enough food on the table, lack of proper housing, and all those things, all this social aspect of the individual's life. So what do we do, in able to make sure that we're able to support the individual, to support the families? And that is where we come in as social workers. So the food security, ability to afford the food, housing, rent, is the person, especially in this period where a lot of people are either laid off, or some people are still working, but they're not working full time. So some people are scared, am I going to be laid off? And if they're going to be laid off, talking about housing, are they going to be evicted from, where they live? Or because if they're not able to pay the rent, will the landlord allow them to live rent free? So those are the things, that, disturbs, so to say, the individual, and then also act as the problem or the social issues that the individual go through, in every or the day-to-day life of the individual. So also we talk about the culture, and languages. I was listening to Dr. Ugwunze's presentation, and he talked about mint, why people believe that when you take antidepressant, you can be addicted to it and all that. Just to tell you that I was listening, I was paying attention, So, but, in culture and language aspects, there are people believe different things. People look at different things as being taboo. Am I allowed to go out, where am I allowed to go? And also the language, people don't understand, we're in this part of the world, in North America, not everybody understands the English, not everybody understands, but so good to say that, in social work practice and in different organizations that do provide social work services, they have language interpreters that interpret the language. And for most organizations too, they provide languages in different they provide services in different languages. Transportation, we see that in this era of COVID-19, people are scared. If I go out, am I going to be touching people that are affected? Am I going to be sitting with people that are affected, especially when you're taking public transportation? Remember, it's not everybody that is privileged, to own a car or be driving. So people have all those fears, and those are the things that are actually, because of the fear, is kind of shaping or determining their health, their life, or their health life. So access to healthcare also. There are a lot of people that are in this part of the world, that they are not, so to say, they don't have their documents, they don't have status, as we say it here. So they don't have their papers. And if they don't have their papers, how are they able to access, healthcare? So those are the different barriers that people face, in their day-to-day living. And that is, again, that's where we come in as social workers. So what do we do? The social worker support, what do we do? What are the support that we provide, for the individuals? This is the next slide that I'm going to be talking about, is the social worker support. So when we see clients, or when we deal with clients, we are dealing from the strength-based, services. What it means is that we are not judgmental. We're not asking, oh, you cannot do this. What we ask is, what can you do? What are you good at? What gives you joy? What makes you happy? Dr. Remy talked about self-care. doing something that makes you happy? Those are the kind of questions that we ask. And those are the kind of things that actually help to, keep the individual in living in a good health or in a mental health, and also supporting in their psychosocial, needs. What do they have? What can they do? So we operate from a strength-based perspective to help the individuals, and we respect and value the dignity of all people, all culture, not biased, not judgmental, and in our working relationship with our clients. We help our clients, when we come together, we help our clients to set and achieve goals. What do we mean by setting and achieve goals? Where do you want to see yourself in the next 3 months, in the next 6 months, in the next 1 year? How do you want to see yourself? Where do you want to see yourself? What do you want to see yourself doing? Or where do you want to see yourself being in? So those are the goals. And when we sit together with the individual and we talk about it, so we help them to set that goal. We as social workers, remember, we don't make decisions for individuals. We help them, we support them in making their own decision. They set a goal, and we also help them, support them along the line in working towards achieving those goals that they set for themselves. Recognize diverse needs and experiences. People go through a lot, especially again in this era of COVID-19. There are a lot of people that are either have lost somebody, separation, disability, homelessness, just different things that people are going through, or different experiences that people are going through in life. So we support the individuals, we support families, we support communities to promote, to promote, accessibility and responsive programs that will serve those needs, either grief counseling, either supportive counseling. All those things, we are there to make sure I'll guide them into accessing and receiving those services that are available. Because trust me, there are a lot of services that are available out there. It's just about knowing where they are and how to access them, and it helps to go a long way. We also facilitate access to community resources. That's part of what I just said, like helping them to know where to find what. Because if you don't, what you don't know until when you know that they said the beginning of solving one's problem is knowing where to get those solutions. So when we have to direct you to where to get the solutions, it's about helping, you to getting or achieving the goals that you have set for yourself. And we also help, growth and development. We help our clients, to make sure that, as they develop, as they grow, when you come in with whatever you come in, we don't judge you with what you come in. Like I said, we are not judgmental. We just make sure that if you want to come out of it, you want to grow to whatever level, it's all about tied to setting the goal and helping you to achieve and develop, in whatever area that you need. Those are part of the supports that we have, as a social workers for the clients. So how can we help? How can we help? The next slide is how can we help? We support our clients, in different areas through supportive counseling. We can sit with you one-on-one. We just, sometimes people look for somebody to talk to. People want just somebody. So many people in this part of the world are living alone. So many people are living alone. They don't have anybody to talk to. They don't know anybody. So, but when you come to meet with us as social workers, we are there to support you. We talk with you. You have somebody to talk with. You have somebody to open up to, and then we are able to listen to you and also provide different options. Like I said, we don't make decisions. We provide options for you, and then you are able to choose that which is right for you. Violence prevention and counseling. There are a lot of things going on, with this COVID-19 issue. People are getting into maybe gun violence, partner abuse, all those things are going on. People don't know. When we listen, there's always help. Like I said, there are a lot of resources, there are a lot of support that is out there, and we are all open and willing to support. We provide, the counseling, violence prevention counseling, how to prevent it, and if you're already in it, how to come out of it, how to overcome it. Those are the things that we do. Employment, housing, childcare, we help. People are looking for jobs. A lot of people are losing their jobs. We are here to support, to help you, because again, you have to have some level of networking, and you might not know there are some people that are hiring. So when you come to us, because we have a pool of all these resources and information at our beck and call. So that is why you have to reach out to a social worker. When you come to us, if you're looking for a job, we look at what are you good again? What are you good at? What can you do? What have you studied? So we're able to link you or to connect you, to where you find a job. Or even if it's a temporary agency, we can connect you. If it's a full-time one, a part-time job, we can connect you. We're always there to support. Housing, people are going through a lot. Some people are almost at the edge of being evicted from where they live. And so we as social workers, and when you come to us, we look at your situation, we assess your situation. And if your situation is that there, we are able, also to make a referral, to make an application for you and a referral for a subsidized housing where you can stay, and take care of yourself and your family. And there are some people, when I say some people's cases are there, some people are, some people are in crisis. So we kind of move them through our application and assessment, we move them to a priority list so they're able to get it faster. For childcare, we also provide that, not directly, but we link you, to services for childcare. Like I said, we are not judgmental. Whatever you come, we don't judge the person. We respect the person before we talk about the issues that the person is coming with. Because first of all, you are a human being. So we respect and value your dignity as a human being before whatever issues that you come with. Thank you, Danasa. And this is the next slide, please. This is where we can be found. These are the resources where you can find a social worker, or you can find an organization that provide all these services. You have 211 Toronto, you have community hubs. 211 Toronto, when you go on it, when you go on 211 Toronto, is a hub. It's like a list of different organizations within the country, both in the GTA and other provinces. You can find resources there. Schools, hospitals, community agencies, religious places and places of worship. You can find the social workers there, and where you can find us there. And what to do, finally, what to do during this COVID-19, like Dr. Remy said, take care of yourself. Self-care is very, very important. That is the first step. You must take care of yourself. Even if you have children, you have spouses, you first take care of yourself before you can even think of taking care of your children. Because if you are not able to take care of yourself, then you don't have the ability to take care of another person. Seek for support, reach out, talk to somebody, reach out to somebody, your community, your friend, your family, even your neighbor. Reach out to somebody. Don't stay in isolated or in isolation. Do something that makes you happy. Dr. Remy also mentioned that. And if you experience loss or death of a loved one, make out time to mourn. It's okay to mourn. It's okay to cry, because it helps in your healing. Do something to help yourself. And finally, there's a lot of calls, going out, about, violence. So I always tell people, don't die in silence, seek out support, reach out to people, and you will always get support, because trust me, there's a lot of resources and support available within the community and within the country. My time is almost up. Finally, before the last slide, before I go, I just want to, just for laughter, I just want to share this, because something that I saw and it was very, very interesting to me is just for laughter. I say, avoid men in this period of COVID-19, avoid men, mouth, eyes, and nose, that those are men, and instead follow women, wash your hands, obey social distancing, mask up, exercise and eat well, no unnecessary gathering and traveling. Do all this to play your part in flattening the curve, and stay safe and well. Thank you so much.
Thank you to all our amazing panelists. They did an amazing job dissecting all the information that people need at this time. Like every other good thing must come to an end. At this time, this is where we call the cutting off. Don't fail to go, follow all the social media handle of Women Focus Canada, and as well as their website. There's so much information there at the Women Focus Canada.org. That is where you get all the information. You can't miss it. Have a good evening.